All right. So tonight's lecture is about peptides, exosomes, and stem cells. For those of you who don't know me, I'm Dr. Debra Muth. I'm a naturopathic doctor and nurse practitioner. We will record this. We will also send this out to you guys in email. We also put it on YouTube. If you don't get it on the email, you can find it there as well. But we are going to talk about all three things tonight. And we're going to talk about how peptides, exosomes, and stem cells all allow us to heal. And it's, in my opinion, it's really the future of regenerative medicine. We've talked about regenerative medicine for decades since I've been in functional medicine, which has been almost 27 years now. We've always talked about regenerative medicine, and it's kind of changed its philosophy or its definition over the years, of course. Um,
Talking
and
about the
I
stem
think
cells and the exomes.
you guys want to just mute yourself, please. That'd be great because I can't see you. Um, so I really think peptides, exosomes, and stem cells are really kind of the next generation to regenerative medicine. It has made a huge difference in the patients that we've used it with, especially chronic illness, autoimmune diseases. There's a abundance of cases that we've used peptides and exosomes and stem cells in. And there are, and I'll talk a little bit about them as we go forward. But they have changed for a lot of people. And I'll share that too as we get going. So I'm just going to dive right in because otherwise, you guys know me, I can chit chat for a very long time here. So, peptides, exosomes, and stem cells are communicating with the body's healing intelligence. And I think that's where we really need to think about these things. They are sending the messages to the parts of the body that are damaged or not working to their best potential. And they are causing a signaling to occur on that area of the cell that's no longer working the way it's supposed to. So, whether it's a damaged cell from infection, whether it's a damaged cell from an autoimmune disease, whether it's a tissue damage because we've got degeneration in a knee or a shoulder, um, or whether it's a process in the brain, these peptides, exosomes, and stem cells can go to that damaged area. They can find the damaged area. We don't have to tell it what it is. And it will start communicating for the body to send all of its healing properties to that area. So there are some peptides that we use specifically for inflammation. There's some that we use specifically for brain. There's exosomes and stem cells, and I'll talk about each of them and how they differ and why we use some over the others. So, like I said, I really think that this is our new paradigm for medicine. The body is healing through more of a cellular communication, not a control issue. In integrative medicine or functional medicine, I think we tend to have more of a control process that happens. We give you a supplement, we expect that result to happen. We're pushing the body to do a particular thing. When we're using peptides, exosomes, and stem cells, and it's restoring the communication networks rather than trying to override them with supplements or herbs or medications, it prevents the symptom suppression and really moves more towards a cellular restoration. We've seen this happen quite a bit where we've worked with people for a couple of years on trying to get them to a place where they're truly healing and we're stuck and we introduce peptides, exosomes, and or stem cells. And within a month or two, all of a sudden their body starts responding very differently. And sometimes that's because when we use herbs and supplements and medications, we are sending a different message to the body and we're trying to force the body to do something we want it to do. And the body may not actually be ready for us to do that. And so what we're now finding is that we need to prime the body a little bit before we can force it to do what we want it to do. If we want this true healing process to happen, we may have to build the body up first before we can bring in killing agents or before we can force other things. Not always, but sometimes that makes a big difference for people. Okay. So what are peptides? Peptides are short chain amino acids. They regulate the immune system, the hormones, the neurological system, and our metabolic function. One of the most common known peptides is GLP-1. So Ozempic, Wegovy, Zepbound, all of those GLP-1s are actually peptides. So they're actually telling the body to do something in the metabolic function. For instance, make more insulin, turn off your appetite, increase your body's own capability of using its body fat for fuel. They're meant to do a very specific thing. There are other peptides, which I'll go over shortly here, but each one of them has one or two actions, sometimes three, but usually it's one or two actions that we're trying to get the body to do something with. They break down in signaling. So when the body's under chronic illness, chronic fatigue, or an autoimmune disease or some kind of immune dysregulation, the body cannot make the peptides that it needs to, or it cannot get the message that the peptides are sending to the rest of the organs of the body so that it can function properly. And that's where that messaging part of the system is at fault. And it can't do the proper messaging. Therefore, it's not getting the signals, and then that organ system can't function the way it's supposed to. So it's really not as complex as we'd like to make it out to be. Women respond beautifully to peptides, partially because they already have a very complex endocrine system. They already have a very heightened immune sensitivity. And estrogen influences their entire mitochondrial function. And so it's very important for us to have estrogen present in our aging process, because if we don't have estrogen present, our neurological function is not going to be as good. Our inflammatory markers are going to be worse. Our cognitive function is not going to be as good if we don't optimize estrogen. Estrogen is necessary for every cell of the body, whether we're 25 or whether we're 125. It doesn't really matter. Estrogen also gives us better neuroplastic potential. So, meaning that focus, that concentration, the way the brain expands and contracts, the way we multitask, we need all of that to function based on estrogen. So, as we go into menopause and we lose that estrogen, we start to see all of these complications occur that could be rectified by using estrogen and or particular peptides that increase the estrogen signaling system in the body. So for people who can't necessarily take estrogen because of breast cancer risks or cardiovascular risks, there are certain peptides that we can use that help fill that gap in the endocrine loop so that you can get a lot of the benefits of estrogen without actually getting estrogen and increasing your risk for cancer. Now, there are a lot of peptides that you can't use as well if you have cancer or if we're concerned about cancer, but there are some that we can use that work very, very well for this. And men respond really great as well to peptides. It's just women tend to respond a lot quicker and a lot better than men do, simply because of that estrogen loop. So here are some key peptides that we use. Thymosin alpha 1 or TA1 is an immune modulation peptide. In the world of chronic illness, chronic inflammation, autoimmune disease, your TA1 peptide is a game changer, and it's going to be the one you want at the core of your foundation of peptides. And then we use something like BPC 157, also very commonly known for tissue and gut repair. For people who have leaky gut or gut dysbiosis, BPC 157 is an amazing peptide, especially if it's taken orally. If we need tissue repair, for instance, you injure your knee, you sprain your ankle, throw out your shoulder, things like that, then we want to use BPC 157 in an injectable instead, because it's better to get at that tissue as close to the source of the injury as possible to get repair. You will get some gut repair with an injectable peptide, but with a gut repair peptide, it's better to put it in the body and let it go to the source of where we want it to heal. And then we have CJC 1295 with ipamorelin. Ipamorelin is a growth hormone peptide, And CJC 1295 is a repair peptide, also a growth hormone peptide. This can be a precursor to growth hormone. So, unfortunately, growth hormone is not accepted by the FDA in this country unless you have a primary growth hormone deficiency and you can document that. But after the age of 30, we start losing growth hormone. And so it's really important for us to replenish that when and if we need to. But since it's very difficult to use real growth hormone and it's a lot more expensive to use real growth hormone, we use precursors like ipamorelin, sermorelin, and those things will help your body naturally make more growth hormone. When we have more growth hormone, we have better cognitive function, better sleep, better muscle building capabilities, better mood, just kind of all around. It's a better product for us to have and a better way of getting hormones. The one thing about CJC and ipamorelin that I would say is it's not a peptide that you want to go to until all of your hormones are well balanced. If we start pushing growth hormone before you have good balance between estrogen, progesterone, and testosterone, DHEA, and pregnenolone, A, you're not going to get the full benefit, but B, it can make some systems and some symptoms occur that you don't necessarily want to have happen as a result, simply because all of your other hormones are not well balanced. Kisspeptin is a really great reproductive singling peptide. It can be used for both men and women, but primarily we focus it on male fertility. Can work really nicely, especially when we don't want to use testosterone, because testosterone actually decreases your fertility. It doesn't increase your fertility. So if we need to raise someone's testosterone level, but we don't want their fertility to be affected, we would use kisspeptin then. And then we have CMAX and C-Link, which are really great for cognitive repair and anxiety. Both of these help to repair the cognitive part of the brains, really good for temporal and prefrontal lobe issues, but also very good for anxiety. So, especially for women, as we age and we lose those hormones, we tend to become more anxious naturally. CMAX and C-Link can help with that. For people who are struggling with Alzheimer's disease, dementia, brain volume loss, CMAX, C-Link, cerebral lysin, these are all peptides that are great for helping with that cognitive function and that repair of the neurons that are becoming damaged from a variety of things, whether it's chemicals or metals or pesticides or herbicides or infection. It can help protect the brain. And we have seen it used along with exosomes, and we can actually see increased brain volume as a result of that. We have MOTS-c, which is very similar to GLP-1s. I don't think it works as effectively as a GLP-1 for weight loss, but it can work really well. And for people who are really sensitive to GLP-1s with nausea or heartburn or headaches or some of those other side effects like constipation or diarrhea, MOTS-c can be used as well. Really good actually for people with type 2 diabetes that are trying to control their diabetes. It actually helps to balance the insulin levels and can get you out of type 2 diabetes with the proper diet and exercise. SS31 is also a really nice mitochondrial peptide. So in any of the chronic illnesses, whether it's Alzheimer's, dementia, infection, pesticides, herbicide, any of those kinds of things, it's a mitochondrial issue that occurs at the root of the cells not functioning properly. And so SS31 can be a really nice peptide to come in and help repair that mitochondrial damage, that cell structure damage, so that the body can start repairing and healing itself properly. Okay, so let's talk about cells. So, what are embryonic cells? Well, these are cells that are derived from embryo tissue, usually placental or umbilical cord stem cells. They are used to repair the body, regenerate, restore. I'm going to see if I can move this a little bit. Yikes. I don't know if I can make this smaller. Sorry about this, guys. It's going right over our stuff here. Let me stick it up here. They also can help with underlying gut issues, immune issues, mitochondrial issues. They support and repair and regenerate, and they reinforce a new baseline and prevent a relapse of disease and damage. So these embryonic cells are we call them blank cells, meaning they don't have any DNA. So they're harvested before DNA can be put into them. So you don't have to worry about there being a rejection of the cells because they're blank to begin with. So all of these cells that are harvested come from donor sites. So the mom has to be willing to donate the embryonic stem cells. They're very carefully tested. They are tested for all the infections, COVID. Not all companies, though, that harvest these will take donors that are non-vaccinated from COVID. So that is a concern, and you want to make sure that you're working with a company that does that doesn't take any donors that have been COVID vaccinated, because otherwise you have the potential to grab that mRNA. So really important to know which companies you're working with and the quality of the companies. So how do stem cells differ? Well, stem cells are the master coordinators. So we once thought to replace damaged tissue known to signal regeneration that you had to use stem cells. And stem cells calm the inflammation, direct the immune shift, and rebuild damaged tissue. Like in type 1 diabetes, spinal cord injuries, multiple sclerosis, they're using stem cells. When we do back surgery and we're putting cages or we're doing a fusion, there is a surgery where they will take stem cells, they'll harvest stem cells. Typically, they're from donor bones, so cadaver bone. They'll grind that up and they'll put that into the spine to harden and replace the bone that they cleaned out. In order for that bone to regenerate and reactivate, it has to be mixed with something that's live. So they usually have to harvest bone from the person they're operating on to mix it with the cadaver bone in order to put it into the spine for it to actually take and harvest. Now, that stem cell bone is going to have DNA in it because it's coming from a cadaver source. It's already been living in somebody. It's now harvested from that person. It will have some DNA there. So there are studies all across the country being done for type 1 diabetes, multiple sclerosis. They're doing it for Lewy body dementia, ALS, you name it. You can find a study off the coast of the US where they're using stem cells to try to repair this tissue that's been damaged. In the US, the FDA has very specific rules of using stem cells. And we'll talk about that in a little bit. I'm kind of getting ahead of myself. But so there are different types of stem cells. There's MSCs, mesenchymal cells from bone that I was just talking about. You can harvest MSCs from fat and then umbilical cord, which we talked about. We really like the umbilical cord better because there are studies that show that stem cells that are harvested from a person's own fat can potentially increase their risk for cancer down the road. Bone marrow is just uncomfortable to harvest from and complicated, and we don't need to do that kind of procedure for what we're trying to use stem cells for these days. You can also have what's called hemopoietic. This is what's used in bone marrow transplants. And then there's neural and iPSC, which is still experimental, but it is showing some promising results as well. And again, all of that's being done outside the country. So with exosomes are cellular messengers. They're tiny vesicles that deliver genetic and protein letters between the cells. Exosomes are small enough that they can cross the blood-brain barrier to regulate inflammation and promote healing. Stem cells are too large to cross the blood-brain barrier. So if we have something that we're trying to fix in the brain, like autism, Alzheimer's, dementia, Parkinson's, MS, those kinds of things, we want to use exosomes, not necessarily stem cells, because we want that to cross the blood-brain barrier and we want to heal what's ever happening actually in the brain. Currently, there are no FDA-approved products in the United States. They are for investigational use only, and they can be done in an observational study. And inside that observational study, as long as things are being documented properly, you can opt to participate in that observational study. for exosome therapy. Okay, so let's talk a little bit about the different types of exosomes versus stem cells. So on the left, you can see the source, and then we have exosomes and stem cells. So exosomes are derived from cells. Stem cells are live cells. They're bone marrow, umbilical, and adipose tissue. In regulation, exosomes do not have FDA approval for systemic use, but they can be used in a joint space. Stem cells are limited approval use at this point. And some of the different advantages are exosomes cross the blood-brain barrier. There's less risk of cell growth. But with stem cells, there's broader tissue repair. So sometimes we may want to use exosomes and stem cells, depending on what we're trying to get it to do. For instance, an example would be, say you have some cognitive issues going on because you had Lyme disease, but you also have joint pain and you have a torn rotator cuff and you have a bad knee. Well, we would necessarily look at saying, okay, maybe we can combine things and we can do exosomes and stem cells together. Exosomes to cross the blood-brain barrier for the cognitive issues and the autoimmune issues, but stem cells to actually go to the tissues and the organs that we want to have repaired, like a knee or a shoulder or something like that. And then there's always risk involved with anything that we do. With exosomes, the quality can be variable. So again, this is where you need to really know who the manufacturer is that you're using and where they're getting their products from. With stem cells, there's a much broader regulatory restriction as to how they can be used, where they're used, when they're used, that kind of thing. We have a little bit more flexibility with exosomes. So we've created the Root Rise Restore program. It's an integration for cellular therapies. We choose GMP or FDA compliant products in our office. We avoid research only sources. In peptides, you're going to see a lot of sites that show that they're not for human consumption and they're only for research purposes. I would be very cautious with them. If you're buying them online, you want to really know where you're buying your product from. There are many stories of people who've gotten their peptides and they've come in from China, and it's not the only thing that's in the vial is the peptide that you thought it was. For instance, there's a story of a growth hormone peptide where the Chinese manufacturer decided that it would be best to put testosterone in this product along with it. And the men that were taking testosterone separately didn't know that. And their testosterones were going through the roof. And there was a lot of complications as a result of that. Now, you can only imagine if a woman was taking the same product, the CJC ipamorelin, and they had put testosterone in there, that would not necessarily be the best thing for them to start having high levels of testosterone without them realizing what's going on. And nobody would be technically thinking that testosterone was an issue based on this product. So you want to really know the companies and the manufacturers that you're getting things from. You want to always be wary of miracle claims that lack transparency, or there's a large cash prepayment requirement for you. Like you have to buy $500 worth of product or something like that. Or you have to buy it by tonight to get this deal. Be very cautious about those kinds of things because those are usually the gimmicky type things. I would also say you're starting to see a lot of multi-level marketing companies get into the world of peptides and stem cells and exosomes, and they're claiming that their capsule-based or their patch-based product is going to do the same thing as an injection is. And that couldn't be further from the truth. Those things are not going to penetrate through your skin properly. A lot of the peptides need to be given by injection. There are a few companies that are created specifically for practitioners' offices that are capsule driven, where they've spent hundreds of thousands of dollars in testing these products for absorption through the gut. We use some of them, and I will say some work really well, some do not. We still see better success a lot of times with injectables over capsules. And so it's really important to work with a practitioner who understands the differences of the products, who's researched the products, and you can trust that they're giving you a product that's of high quality and not of something that you're just going to waste your money on, because these things can be very expensive for no reason then. All right. So, what's on the horizon for medicine? I really think it's involving exosomes in a therapeutic or precise signaling, um, autologous stem cell activation, targeted peptide sequencing, epigenetic reprogramming for generational healing. I think these things are what we're going to see become the new forefront of medicine. Um, it's really important, though, to understand that these things still have limitations. They are not the end all be all. We're still learning a lot about how to layer them, how they go together, which peptides are best for different things. And a lot of it is trial and error. What works for one person doesn't necessarily work for another person with the exact same condition. We have to try different things. The other thing that I will tell you is, especially when we're talking about neurodegenerative diseases like MS and Alzheimer's and Parkinson's disease, it is not going to be a one infusion and done, or one nasal application and done to cross the blood-brain barrier. It oftentimes takes 3 or 4 of these therapies, given in a time sequence of a couple of months, in order for you to see the biggest impact. And we have to remember that these diseases didn't occur overnight. They're not going to heal overnight. It's going to take a very rigorous approach to get brain regeneration to happen. So don't give up. If you've done it once and it's not working, don't give up. It doesn't mean it's not going to work. It just means that we may need to use larger amounts of them, or different sequences of them, or different product lines, something along that line. But know that it can help. It's just not going to be a quick fix. That's always the hardest part for us to understand. And a lot of these peptides and exosomes and stem cells become very costly. So it is something that you want to take seriously when you are doing this, and you want to make sure that not only are you doing peptides and exosomes and stem cells, or the like of all of those things, you want to make sure that you're preparing your body for the best outcome that you can have with these things. So making sure your diet is healthy, making sure you're exercising, making sure we're doing all of the other things right, so that the peptides and exosomes and stem cells can actually do what your body needs to. If we're giving you, exosomes, and you're going out for the weekend and doing a binge weekend of great carb food and very rich food and lots of alcohol, well, that's not the best example for your exosomes. It's not the best use of your exosomes to be repairing that inflammatory condition that you just created because you went out on a binge, versus the exosomes finding the spots in the body that actually need to be repaired and need to be healed. So it's really important for you to go all in and do all the right things when you're doing this. You're taking the time, investing in yourself, and you want to make sure that you have the best opportunity for these things to work efficiently and effectively.